Hello, I'm Dr. Peter Lynn. I'm a wellness chiropractor specializing in chronic metabolic and neurological health conditions. Today I'm going to talk to you about the headaches and the back pain you may have been experiencing, because you see, most doctors treat a symptom or an organ and not the whole person. Our patients are treated metabolically and neurologically. If you've had this problem for any number of months or years, you're going to fall in the same category most chronic people with chronic problems have. And it's this: they all have one or more of these in common: oxygen deficiency, metabolic imbalances such as blood sugar problems, cortisol and hormone dysregulation, digestive disorders, types of anemia, autoimmune attacks, and brain imbalances. See, if you understand how your body functions, you can appreciate how it can break down, and then you know how it can be fixed. Treating symptoms like the pains we were talking about, or aches like headaches, is like treating a symptom with medication. It's like putting air in a flat tire and never finding out what made it go flat in the first place, and putting air in it over and over again, hoping to see change. So you've got to see what the whole system's doing and working or not working correctly so you can get the problem fixed. So I want to talk to you. We're going to go into different organs and glands and see how important they are in your system, and if they're misfunctioning, dysfunctioning, why that's important to get it fixed. Because if a problem continues with dysfunction, it will turn into pathology and disease. How do you know? Well, you do it by testing. And testing unlike you've ever had before. There are two kinds of testing that we do in the office. The first is a complete laboratory analysis. Well, we don't do that in the office. We send it out to the lab. But it's not a typical test that you've had. It's not in pathological ranges that you've had or heard about. It's in functional ranges. In the past, you've had lab markers come back and maybe they've been normal. But what you need to know is that there are functional ranges that every marker falls into. A pathological range, for example, of fasting glucose is 64.8 to 104.4. That's a pathological range. But what about the high normals? What about 102? Is that still normal? Or what about 66? Is that still normal? Well, in the pathological terms, that is still normal. But functionally, that's way outside of functional ranges. Normal blood sugar in a functional range should be between 85 and 99. When you start pushing outside that, you're going to have dysregulation. Maybe not pathology, but dysregulation, and that needs to be fixed and addressed. So we look at things functionally. We're looking for breakdowns and malfunctions in multiple systems in your body to find the underlying cause of your problem before it turns pathology. We're going to check different markers such as a complete thyroid panel, not just TSH, but T3, T4, a complete metabolic panel, a lipid panel, vitamin D levels, a complete blood chemistry with auto differentials. We want to do sensitivity testing, DNA analysis on antigens that almost every person with a chronic condition has positive. A number of years ago, I wrote a book called Barren Harvest, and it's a novel about genetically modified foods, foods that literally we've never seen in the history of the world, and we're beginning over the last several years to digest them and eat them. You don't know about it because it's been suppressed, but I'm telling you, a lot of these foods that you're eating commonly today are wreaking havoc on your digestive system, and we're going to see problems in the next several years because of this. We want to test your adrenal levels and see what your stress levels are. See what your cortisol output is. We want to see if you have autoimmune disorders and getting an in-depth picture of your immune system. Intestinal permeability to see if you're absorbing the foods you eat. We want to do a neurotransmitter profile. We want to test hormone panels. These are especially important if you're complaining of depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and just decreased physical stamina. We want to check your inflammatory markers such as C-reactive protein and homocysteine. You see, we're looking for several deal breakers that must be addressed if you're going to get these well. These are such as blood sugar imbalances, fatty acids like cholesterol, anemias, liver and digestive imbalances, and autoimmune systems. To understand what is affecting your health, you must be evaluated completely. We are past the days of, here, try this drug or ibuprofen and see what happens, and you might get better. Today we can find out what's going on and get the problem addressed. So metabolic testing is one half the equation. The other half is evaluating the functioning of your nervous system. Your nerve and brain system need two things to survive: glucose and oxygen. If these are faulty, your brain is faulty, and the rest of your body suffers. So we're going to evaluate you neurologically. We're going to test out your reflexes, your eye patterns, your cranial nerves, your cerebellum. We're going to do movements to see what your spine and neck are doing. See, because the spinal cord carries energy from the brain to the rest of the body like a river, and it relies on feedback up to the brain. If the brain isn't receiving the correct input, it can't have the correct output. You're going to have muscle tension, you're going to have headaches, you're going to have back pain or neck pain. You're going to have all these symptoms because of faulty neurological functioning. So we want to check the input to your brain and see if it's working, and improve that if it's not working, so we can get a better output. Otherwise, you'll still have the aches or pains or dizziness or balance disorders or equilibrium problems that you may have because of faulty input and output from the nerve system. And it's not because of a lack of a drug that you have these problems. It's from faulty neurological and metabolic processes. So to fix the problem, you have to diagnose the problem by being thorough in your examination. What part of the brain needs help? You have to test neurologically. What part of the metabolic system needs help? You have to test that metabolically. And check the functional ranges, not the pathological ranges. You have to test the guts, infections, the blood sugar problems, the autoimmune processes, those kinds of things, and get them fixed up. Well, what happens then is we put together profiles of protocols such as metabolic plans that may include customized protocols of vitamins, minerals, and supplements, a customized nutrition plan of like what to eat, what not to eat, when to eat, and how to eat. We're going to basically change your lifestyle. And then on the neuromuscular part of it, we're going to do brain-based therapies. These are all neurologically based and clinically proven to cause massive changes in the nerve system. And they may include exercise with oxygen, to perfuse oxygen deep in the cells and the muscles so you can get the energy back. We may use some types of electrical or microcurrent stimulation, or olfactory stimulation, or visual or auditory. We might do some eye exercises to fire up the parts of the brain that aren't working right. You see, all health problems are a combination of causes. Most health problems are syndromes involving multiple systems. Correcting the brain misfiring and metabolic dysfunctions help the body to reassemble itself back to health again. And retesting lets us know we are on the right track with our treatment protocols, and allows us to make the changes that were needed to get you on track, keep you on track. We treat the whole body and the whole person by striving to bring all the pieces of the puzzle back together again. So here's what to do. We begin with a 2-visit program. You call our office and schedule an appointment. You fill out the paperwork while you're waiting to get in and have it on my desk, and any recent lab work you may have had over the last several months. And before your first visit. Then on that visit, I'll go over that paperwork with you that you've completed, and I'll perform a functional neurological exam, and then you'll be dismissed from that first visit. Then on the second visit, we'll review the neurological findings from the first visit and discuss why I am or am not able to accept your case. If your case is accepted, we will discuss what the functional metabolic testing will be needed, and the preliminary neurological treatment that we're going to do, and the financial plan involved. It is important that you bring somebody with you so they can understand what you're going through. Now that you know there are answers to your health issues, I want to ask yourself, like I ask everybody, these questions. How has your condition affected your job, your work, your relationships with your family or friends? What's it kept you from doing? And what's it cost you in time or money or effort? My favorite question is, where do you picture yourself in the next 1 to 5 years if this problem isn't taken care of soon? And what's it worth to you if we can really get to the bottom of it, find out what's going on, and get the problem fixed and corrected and get you back on the road to health again? I hope this brief video has answered a lot of your questions, and to let you know that there are answers out there that are very different and very refreshing in the world of healthcare today. I hope to see you soon. I'm Dr. Peter Lind.